the Truth and Reconciliation calls to action have specific calls for those of us working in the health sector, and they call us to acknowledge and understand the ways in which colonization has contributed to some of the health outcomes that we see that particularly affect Indigenous communities. And they ask us to monitor them and to actually hold our healthcare system to account to improve that. I'll just briefly talk about my work with Two-Spirit communities, and I have to especially acknowledge one of my graduate students who's also a community organizer in the Two-Spirit community, and that's Harlan Pruden. And Harlan has opened the door for me to really look at what it is that's very unique about Two-Spirit in an Indigenous context. So just briefly, I'll try to give a definition, which is that before the arrival of Europeans to Turtle Island or North America, many Indigenous cultures had roles for people who were gender diverse, people that today we would think of maybe as LGBTQ, but were conceived in very different ways in pre-colonial societies. Those roles were in many cases lost or nearly lost through the process of colonization. We know that the residential schools, in addition to stripping Indigenous people of their cultures and connections to family, also reinforced really binary notions of gender. Boys go over here and have your hair cut short and dress like this, and girls go over here and you behave this way. And that had a really terrible effect of leaving generations of Indigenous children without that connection to their culture that would have otherwise made them feel included and affirmed in their sexuality and gender. So Harlan and I co-facilitate a group called the Two-Spirit Dry Lab. It's kind of working in collaboration to the Reaffirm Collaborative, but with an explicit focus on Indigenous, Two-Spirit, and other LGBTQ Indigenous people. We try to collect data that better explain the social conditions and the health of Two-Spirit people, and we try to understand what it is about Two-Spirit that facilitates access to health. We're seeing a remarkable resurgence of celebration of gender and sexual diversity in Indigenous communities. There's numerous Two-Spirit Indigenous-led groups and services, social and health services happening right across British Columbia. So it's a fantastic time for us to be asking the question. And I think for me as a settler, there's a lot that I can learn from Indigenous Two-Spirit leadership about how do other conceptions of sexuality and gender diversity maybe enrich our understanding of humans and human health.